and post-op. Okay? See the different size pupil?
How much is the size of the hole?
1.5 millimeter pupil. Less than 1.5. Okay? Come this way. Eye hospital has started a new technique called Pinhole Pupilloplasty or PPP for the first time in the world. Basically, any person who has got an eye injury, or let's say keratoconus, where the front window is conical, or some infection in the cornea because of which scarring has occurred, or radial keratotomy. Basic principle here is any patient who is nearly blind because the power of astigmatism is about, let's say, 20 diopters or 24 diopters. All these patients, we have a major problem. Either I have to do an eye transplantation or do some major surgery, because even laser will not work for such high powers. Now, a simple phenomenon we did was to make the eye like a pinhole. The front iris, which is like the diaphragm of the camera, we made it small to approximately about 1.5 millimeters. It's a very simple procedure, takes about 10 minutes. But the big advantage is a person who's nearly blind can start seeing immediately. And it is permanent. Because there's no chance of rejection in an eye transplantation, there's a chance of rejection. Here there's no such problem at all. It is a procedure which can be done by any eye doctor in the world. Any technique can be used. We use the single pass 4-throw pupilloplasty. But basic principle is what? We are making the eye like a pinhole like this. If you see a mammal or an animal in the marine animal called the mollusk, called the nautilus, it has got an inborn pinhole eye. What we have done is, if you go to any eye doctor, any optician, they always have a pinhole. They put it in front of the patient's eye, basically to see whether the person will improve his vision or not. We have made the front iris, which is the shutter, basically, of the eye, like the diaphragm of a camera, into a small pupil. The advantage of one more is the patient sees distance and near clearly, because the rays of light focus through a central 1.5 millimeter. Normal pupil is larger and we don't want this to be happening. We can also dilate the pupils a little bit and see the retina in the back. Suppose somebody has some retinal problem in the back, we can also examine it, which could be a negative of pinhole pupilloplasty. But with this technology of single pass 4-throw pupilloplasty, we were even able to examine it. So we had patients with me who had an eye injury, glass piece inside the eye. We removed that, but that produced a scar in the cornea. Because of this, he couldn't see. With this pinhole pupilloplasty, he could see. Some other patients in small children, I have done it in adults, 60, 70-year-old patients. Age is not a criteria for this. If a child comes to me with an injury, I will do it. If an adult comes to me with a problem, we can do it. And as I said, this can be done by any surgeon in the world. You know, that is the best beauty of it, because it's so simple and treatable.
For the eye donation, and even we have witnessed that your hospital and you yourself have come forward for this eye.
What we are doing in eye transplantation basically is this new technique called PDEK or PDEK, in which I am taking only 25 micron tissue. The normal cornea is about 500 microns, so I don't have to change the whole cornea, only 25 micron and putting. But in such patients, PDEK also will not work. In these patients, the full eye will have to be transplanted, which is a major procedure, and even after transplantation, rejection can occur. Again, astigmatism can be there. So that is not in my control. Whereas with the pinhole pupilloplasty, it gets treated immediately.